Welcome back to Ask Me Anything. This is our episode where we answer our subscriber questions, our member questions. If you're interested in becoming a member so your question can be answered, make sure to check us out at supercast.renamalik.com so you can ask your questions, get early access to our podcast episodes, as well as transcripts from the podcast. Without further ado, let's get to it.
All right, first question. I am not originally from the U.S. I have never gone to any doctor to have my vagina or private parts examined. When I moved to the U.S. after marrying my husband, I had sex for the first time and realized it was a very painful experience. I thought it would maybe go away with continued sex, but it has not. My neighbor was shocked when I told her I never saw a doctor to look at my private parts. They don't do breast exams or pap smears or things like that in my home country, so was unsure if this is why sex is painful for me. Any thoughts? So yeah, there are countries that I imagine that maybe a pelvic exam is not normal.
Maybe, perhaps, or they don't have access to it to the same degree. So, thank you for asking this question. I think this is an important discussion point. So, sex should never be painful. I think that's really important, that sex should never be painful. If you are having pain with sex, there is an issue that needs to be evaluated. You can't just drink a glass of wine and hope for it to go away. That's not always going to work. So what's important here? One is to identify the cause of the pain with sex. For this particular questioner or member, I would say see a gynecologist and a urologist. A gynecologist to get a pap smear, a basic evaluation, make sure you don't have any signs or symptoms of cervical cancer, anything like that. It's really important and valuable for just general health screening. In terms of evaluating painful sex, there's a few things I tell everybody when you're having sex. One is make sure that you're fully aroused. Now, for women, it can take up to 25 minutes to feel full arousal. So what that means is there needs to be sufficient foreplay for you to feel aroused. And what happens during arousal is the vagina lengthens and widens to double its size to accommodate the phallus or toy or whatever you're using so that it will be more comfortable. So oftentimes, if you don't do that, it will be uncomfortable because you're stretching something that's not ready to be stretched. And two, the cervix is not moved up and out of the way. Now, while some people can find cervix, when you touch the cervix, to be pleasurable, others can find it very painful. And so that can cause an issue. So one is to identify, are you having pain with deep penetration or opening, or when the initial penetration happens, because that may help you as well. The other thing is to consider lubricant. So while a lot of young people think, I don't need lubricant, I should be well lubricated. Well, certainly there is no harm in it, and lubricant can make things a lot more fun. It can make them more slippery. It can make things slide in more easily. So certainly add lubricant to your sexual encounters. Number 3 is the other causes of painful sex. Now, you want to essentially get evaluated to identify what might be causing these issues. One is potentially your pelvic floor. So people can have what's called high tone pelvic floor, where their pelvic floor doesn't relax well. And when it doesn't relax well, it is always sort of clamped down or tense when the penis is trying to enter, and that can cause pain with sex. You can also have something called vaginismus, where the vaginal opening essentially is really tight and clamped down and is painful when you're trying to penetrate. So those are two issues there. Another thing that might be happening is sometimes people can have what's called vestibulodynia. So the vestibule is the area right outside of the vagina. So right before you go into the vagina, there's a special area called the vestibule, sort of surrounds the urethra and goes down around before you get to the labia minora. And that area is hormonally sensitive. And so when there's dysregulations in your hormones, it can be painful to those tissues there, which are right at the opening of the vagina. So you want to evaluate, find out from a doctor if there is tenderness there and if it can be treated with potentially hormone creams or other options. Another thing that causes pain is pudendal neuralgia. So sometimes people get inflammation of the nerves, the pudendal nerves, which supply the vagina, and this can cause pain with sex. So it requires a full evaluation to identify what the cause of your pain is, and then to go ahead and treat the cause of that pain. I will tell people there are general things that can help everybody. So one, like I said, lubricant helps, taking time for arousal. The other thing is working on stress. So I know this sounds like, oh, everyone knows knows they need to work on stress, but really they've actually done studies where they've had women meditate for 20 minutes a day. And they found that after, I think it was 8 or 12 weeks, that women who did this meditation, mindfulness meditation for 20 minutes a day, were having more desire, more arousal, better orgasms, just overall better sexual experiences. And because it was so powerful, many of these women who were in the study continued meditating even after the study was completed. So I think the big take home here is that you can do things to reduce your stress that will allow you to enjoy your sexual experience. There's also sort of a vicious cycle that happens. I talk about this with men, but it happens with women too. When you're stressed about sex and then it's painful, the next time you think about having sex, you're worried, is it going to be painful? Is it going to be painful? Inevitably, it is painful. And now you're more stressed. You're getting into this cycle of worsening and worsening stress, which is certainly not helping the issue. So I feel for you, but certainly there are so many things we can do to help if you are struggling with painful sex.
All right. Yeah. Seek help if this is not something that you covered when you were younger, a younger adult. Certainly look for help. Next question. I am having pain in my balls. I did the no nut November challenge, end quote. And for whatever reason, I decided I was going to avoid masturbation until I met a girl and had sex the regular way. But I've had no luck with women since I started this challenge. I am thinking the pain has something to do with this. Are my balls too full? The pain is more dull-like, not sharp, so nothing for me to lose sleep on, but I will notice it throughout the day, particularly when I am turned on.
Well, there's two things that could be going on. So one, this sounds like what we describe, what you all colloquially know as blue balls. So essentially there's like a fancy term for it, epididymal hypertension. But what happens is when you're aroused, blood flows into the genitals and it causes increased blood flow to also the testicles. And usually when you orgasm and ejaculate, that pressure is relieved. The blood flows back out normally into the body and it, releases that pressure. But for some people, and many of you have probably experienced this, is when you've wanted to have sex or you've been aroused and been unable to ejaculate or orgasm, that it builds up and it becomes uncomfortable. So it may be that in this case, he's having some blue balls. And this is not dangerous, but I will say it can be quite painful. There's actually some case reports of younger guys coming into the ER with pain and like severe pain, and it was actually just blue balls. So it can be quite bothersome. Now, the other thing that I've cautioned on many times on my channel, on this podcast, is that sometimes semen retention or avoiding masturbation can lead to pelvic floor dysfunction because you are essentially avoiding release of ejaculate. And if you're trying to do that and clenching down on your pelvic floor muscles to aid you in that at all times, you can develop what we call high tone pelvic floor dysfunction. And that can cause pain. So I always describe it as like your bicep, if you were doing bicep curls and your bicep got stuck in mid curl, then you wouldn't be able to do a full range of motion with that bicep curl and you'd start having pain, maybe in the bicep muscle, but also probably in the shoulder, probably in the elbow, probably even in the wrist, right? And so similarly, when you have pelvic floor dysfunction, now your pelvic floor can't go through the full range of motion. You can have pain in your pelvic region, in your balls. You can have pain with ejaculation. You can have pain with erections even. Sometimes you could have constipation. Sometimes you can find yourself running to the bathroom, gotta go. And so all these things are really a manifestation of one issue, which is pelvic floor dysfunction. And so that is something that requires you to get help, to get treated, to learn exercises that can help relax the pelvic floor so that you can then, sort of teach your body to get out of this dysfunctional loop so you can no longer have pain. So ultimately, I would tell this person, if they are having this pain that's very bothersome, go ahead and try to release yourself and see if the pain goes away. If it doesn't, then absolutely see a urologist to talk about this issue.
All right. Epididymal hypertension. I've not heard that one yet. So that's something to look up. Next question is, I'm a 69-year-old male. My PSA went from 1.2 to 3.2 about 10 weeks ago. My urologist stopped my testosterone cypionate 200 milligrams per ml, 1 ml every 10 days. So without going into full detail, because he does ask several questions here, what would you do if you had a patient in a similar position, elevated PSA, they're on testosterone? Is there something to be cautious about?
So testosterone is used for exogenous testosterone, or in this case, testosterone cypionate, which is an injectable form, is used for people who have low testosterone or hypogonadism. So they have signs and symptoms, and they have low testosterone on a blood test. So signs and symptoms might include fatigue. It might include erectile dysfunction, low libido, decreased mood, difficulty gaining muscle mass, sort of a host of different symptoms. This person is probably on testosterone for those symptoms, and it can become very life-changing when you have those symptoms and you're put on testosterone, you feel better, right? So a lot of people worry that testosterone will cause prostate cancer, because when we treat prostate cancer, when it was originally found how to treat prostate cancer, we actually castrated men. So we actually removed all amounts of testosterone from their body to treat the prostate cancer.
I did not know that.
Yeah. And so it was then thought testosterone is very bad feeds prostate cancer. And so for many, many years, it was thought that giving testosterone may put you at a higher risk for prostate cancer. Now, we have an abundance of data now, and we just had a recent randomized controlled trial called the Traverse study, which looked at men who were getting testosterone versus not getting testosterone to see if they developed prostate cancer or elevated PSA at a higher rate than people who were not getting the medication. And what they found was that no, they did not. It does not cause prostate cancer. Now, this makes sense, partially because what we believe is that there are receptors for testosterone, or DHT, which is what testosterone converts to and affects the prostate, but those receptors get saturated at some point, meaning that all the receptors are filled with testosterone, and more is not going to affect the prostate. So it's really when you're going from very, very low numbers, like less than 100 nanograms per deciliter, and you're giving testosterone, where you will see an increase in PSA, because now those receptors are getting filled. But above, probably above that, you're not going to see that change. So ultimately, what we know now and what we believe is that testosterone does not cause prostate cancer. But if you have prostate cancer, as of now, we do not recommend giving testosterone to people who have prostate cancer, because it can expedite the spreading of the prostate cancer. So what this urologist is trying to do is to essentially make sure that this gentleman doesn't have prostate cancer, so that he's not giving him testosterone when he has prostate cancer. And that's a very safe, cautious, and appropriate thing to do. And I think ultimately, if that comes back negative, then it's very reasonable to go back on the testosterone. But again, talk to your urologist and, understand the risks and benefits. And I think, again, testosterone is very safe. And in fact, now being used for men, even after they've been treated for prostate cancer, after some period of time, when they've been in remission for some period of time. So it is safe to use. It is reasonable to use. And in fact, what they found is that people who have low testosterone are more likely to get prostate cancer than those who don't. So there is benefit to getting testosterone replacement if you need it. But of course, there are risks and benefits with everything. I've made videos on my YouTube channel about those risks of testosterone, so make sure to check those out. But again, ultimately, I've had some great experts on the channel to talk about testosterone. I'll link one of those interviews with Dr. Morgenthaler here as well if you want to learn more about it.
So always defer to the doctor that you're seeing, who knows you best. Obviously, he or she has examined you and knows a lot more about your lab work and your imaging. So I always defer to that doctor first and foremost.
It's very important to talk to your doctor, because they'll know your history. What was your PSA for the last 10 years, not just the PSA right before this one. So I think they take all that into consideration. Always talk to your doctor. Thank you guys for joining us on today's episode of the AMA. If you want to hear the rest of this episode, make sure to sign up for our premium membership at renamalik.supercast.com, where you can ask me anything. You can get early access to all the podcast episodes, as well as get transcripts from the episodes, and just support what we do here, because we love being able to give you educational content, and this is a great way to support, and we appreciate you so much. And as always, we're going to take care of yourself, because you're worth it.